Well, lately, if you're feeling sick, your first thought might be, could it be COVID-19? Your second, where and which test should you take? CBS 3's Leanne Valdez explains the difference between them and which one may be the best option for you.
As COVID-19 cases continue to spike across the state, and with the many ways to test for the virus, we wanted to get a better understanding of which test is most reliable. First, health experts say we need to understand the two ways they test for the virus.
So we have antigen testing and we have PCR testing, or otherwise known as molecular testing.
Antigen testing looks for proteins of COVID-19. PCR, or molecular, looks for genetic material that makes up the virus in our systems.
Right now, saliva and those swabs can be run on the PCR methods, and typically the swab-only specimens are what's used on the antigen testing.
Essentia Health's Laboratory Business Operations Director, Jeff Radel, says their facilities and the testing site at the deck offer molecular testing. Results for those tests take at least a day. The testing site at the University of Wisconsin-Superior offers antigen, which is newer to the scene. Those offer results in 15 minutes.
With the molecular testing, the accuracy rate with those are typically in about the 90 percentile, mid-90s. The antigen testing is typically in about the mid-80s.
Radel says there are factors that can lead to false positive or false negatives.
The timing of collecting that specimen, if it's collected too early on in the disease process, if that specimen is not kept at the right temperature, or if it's compromised anyway after the collection, that can interfere with the testing process as well.
Radel adds, in the end, it's up to the patient.
It almost kind of comes down to patient preference. So the saliva obviously is a little less.
Essentia Health does have rapid testing at the moment, but they're only using it on hospitalized patients.